Yeah, it found that after 8 weeks of pregnancy, women who worked 2 or more night shifts during the week had a 32% higher chance of miscarriage. That's a lot of numbers. So to break it down a little bit, we asked Dr. Mandira Mehra from SSM Health to join us and talk a little bit more. Good morning.
Good morning.
This is pretty scary, I mean, for women like us who work, and you who work some strange hours. And, you know, a lot of people in these jobs already have trouble conceiving.
Of course, and we've talked about the risk for conceiving, as you've said in the past, and now we're talking about really working those night shifts and working consecutive night shifts, increasing your risk of miscarriage. So a little bit terrifying, like you said, but what the study looked at was very large. First of all, it was a Danish study, looked at over 22,000 women, so very large, compared it also to the national health registries and rates of miscarriage. So what it unfortunately found was that the more nights, more overnight shifts that were worked, the rate of miscarriage increased between those weeks of 8 and about 22. So there's a lot of theories here. We don't know why exactly. We don't know if it has to do with melatonin, that chemical that regulates our sleep-wake cycles, that have to do with the light receptors and things like that, and that's important for not only our sleep but also placental function. Or is it because of some kind of abnormality in the genetics and chromosomes? Is it the stress factor? Is it the cortisol levels? There are many different theories here. That's where more study is definitely needed. You know, the impact here is that it could definitely affect our occupational recommendations going forward. Is that if you are pregnant or if you are in those beginning stages, perhaps those shifts will not be recommended in the future or will be tightly regulated. So more to come in the future, but definitely a fascinating study.
We also want to talk a little bit about a new recommendation by the Academy of Pediatrics. They're throwing their support behind a tax on sugary drinks. How serious is that health risk? Serious
enough that if you look at the obesity rates, you know, in this country, obviously, every time we look at the rates, they're increasing. So it used to be 1 in 10, then 1 in 7, 1 in 5. But when you look at our children, it's even astounding that really 1 in 5 or 1 in 6 are considered obese. Is it the sugary drinks? Is it less activity, technology? Probably in reality a combination of all the above. So what we need to do is start regulating some of these things or giving our kids healthy eating habits and drinking habits. When we talk about sugar, the recommended daily sugar intake is about 6 teaspoons. So to break that down, really in a can of soda, you're looking at 7 to 10 teaspoons of sugar.
In just one?
In just one. And so you imagine children, adult, maybe we're all guilty of this, but whether it's our cup of coffee, a fruit drink, a soda, you know, it's easy to down 2 to 4 of those easily in a day. And so by regulating that, hopefully increasing the tax, you think maybe it would curb some of that ingestion. But, you know, obviously it's going to be a multi-level type thing that would have to take place. Now, sugar is the bad guy here. We always talk about why is sugar so bad for us. We know it increases our heart attack risk, our stroke attack risk, but this study looked at the fact that it increases your mortality risk. So if you have 2 or more sugary drinks a day, the risk factor here of premature or dying early increases by 30, almost 40%. So maybe if we tax these things, we'll have less of that. You know, it worked for things like tobacco, it worked for other things in the past, so maybe it'll work here.
2 really interesting topics this morning. Thank you, Dr. Mehra, for talking with us.
Yeah, great to be here.
Well, just for some perspective on this, the Powerball news, I should say, you are 26 times more likely to get eaten by a shark than you are to win the Powerball jackpot. So we will tell you where a very lucky person bought that ticket right here in Wisconsin.
And Special Olympics volunteers